Acne is the #1 skin problem common between both kids and adults. The #2 most common skin problem is how to treat your acne. Before treating it, you need to know what type of acne you have. In this video, we're going to talk about the different types of acne one person may experience. Hey guys, my name is Bahar and I'm excited about sharing my knowledge and personal experiences about skincare with you. If you haven't already, make sure to subscribe so you too can join our community. Before talking about different types of acne, let's talk about the different things that can cause your acne. Things like overproduction of oil or sebum, bacteria, hormones, ingrown hairs, and maybe sometimes even your diet. All of these can trigger your acne. Now, there are two types of acne in general, non-inflammatory and inflammatory. These two groups divide into 6 subtypes: whiteheads, blackheads, papules, pustules, nodules, and cysts. The first category that I want to talk about is non-inflammatory acne. From the name, non-inflammatory acne doesn't necessarily have swelling, and it is, well, whiteheads and blackheads. Whiteheads and blackheads are somewhat the same. They both are from clogged pores, from dead skin cells, oil production, makeup, and so on and so forth, but they have a small difference. Blackheads have an open pore, which makes them in contact with oxygen. They can oxidize, and hence the blackness of, well, a blackhead. But a whitehead has a closed pore, which remains white. And whiteheads are a little bit harder to deal with because of that closed pore. Both of them can be treated with salicylic acid or over-the-counter retinoids like Differin, but whiteheads might be a little bit more tricky to get rid of. Next category is inflammatory acne. Inflammatory acne happens when bacteria is added to a clogged pore. Benzoyl peroxide can help reduce the inflammation, the redness, and the excess sebum, but sometimes you may need to see a doctor for a prescribed antibiotic to treat it completely. Now, the first subtype of inflammatory acne is papules. Papules happen when the skin around the clogged pore breaks down from major inflammation and makes it red, pink, and kind of sore to the touch. Sometimes it can go away at home, but other times you may need to see your doctor. Next subtype is pustules. Now, pustules are kind of the same as papules, but they are more infected, they are a little bit bigger in size, and they are full of pus. Most of the time, the skin around this acne is pink, but it has a white head, and again, it is painful. Again, it may go away with just benzoyl peroxide, or you may need to use antibiotics. Next, nodules. Now, nodules are one of the worst cases of acne you can have. Most of the time, it is impossible to get rid of them at home. They are bigger in size, they have more infection, the infection goes deeper into your skin, and well, if you pick at it, there is a high risk of leaving a scar on your skin. Last but the worst is cysts. Cyst acne are the most painful and the biggest acne you can possibly have. The infection is way severe. It goes deeper into your skin, even deeper than nodules, and sometimes the acne is so severe that your doctor has to remove it surgically. And this acne is, well, most likely most likely to leave a scar on your skin, even if you don't do anything to it. So just leave it alone, just don't do anything. Most importantly, do not put alcohol on it. Do not put alcohol on your acne. Alcohol can dry out the skin around the clogged pore, resulting in more oil production that can cause your acne to get worse and not better. If we want to rate your acne from least to most severe, at the top would be blackheads and whiteheads. They can be treated with over-the-counter treatments such as a salicylic acid toner, a benzoyl peroxide spot treatment, or even a retinoid. You don't really need to see a doctor for them. Next would be pustules and papules. These may or may not get treated with over-the-counter prescriptions, but if they are widespread and very severe, you do need to see a dermatologist and you do need to get a prescription. Last and most painful are nodules and cysts. These most definitely need to see a doctor. You most definitely need to get a prescription, and you most definitely do not want to pick at them or pop them, because if you do that, then you are at a 100% risk of scarring, and trust me, getting rid of those scars are a pain that you do not want to experience in your life. I have to warn you, it is possible to have more than one type of acne at the same time. If you see that you're struggling with your acne and you can't get rid of it, I advise you to see a dermatologist at your most convenient time. Trust me, they know what's best for your skin. I hope this video was helpful. If you enjoyed it, make sure to give it a thumbs up and click the notification bell so you can be notified every time I post a new video. Done.